Okay, online folks, if you can just type in the chat, if you can see our slides and hear me right now, that would be great. It's like it's going well. I'm gonna close this, but you guys can answer the questions that the online folks will have when you're all done, if that's good with you. All right, fantastic. Okay, I'm excited for this next talk. I always love the stuff about exotic animals. Our two speakers are veterinarians here at AERC. They are part of our internship class. And I'm going to let them introduce themselves. This is Dr. Megan Bradley and Dr. Emma Iverson. And so you'll advance either here with the touchpad or with this little guy here. Get it going, because sometimes it won't do it automatically. Okay, you guys do it.
Hi, everyone. My name is Dr. Emma Iverson. I'm a current small animal rotating intern here at AERC, and I will be starting my dermatology residency at University of Illinois in July.
And I'm Dr. Megan Bradley. I'm also one of the rotating interns here, and I'm actually going to be going to NC State for their turtle rescue team and Natural Museum of Sciences. So I'll be working with a lot of exotic animals, and I'm really excited to work with the sea turtles. That's kind of where my end goal is. But we're going to be presenting on common dermatologic diseases in exotic animals and appropriate diagnostic testing. So to start, we're going to have a little interactive part, and that is, what common dermatologic conditions in exotic animals have you seen in your private practice? Or if you don't see them, what ones do you think you might see? Those are all really good things, and you're likely to see all of those in private practice with exotic animals here. All right. I have one more question. What are some of the challenges you might experience when working with exotic animals in private practice, as these are different than our small animals we typically see? As you can see, there are a lot of different challenges you might experience. These are all things you're going to see. Compliance is going to be a really big one. Oftentimes, husbandry is a huge component. Handling, if you aren't familiar with the animal, is really important as well. So these are just some of the common exotic animals you might see in private practice. It's obviously not a full list, but for your small mammals, you have rabbits, hamsters, guinea pigs, chinchillas, and ferrets. For reptiles, you might see bearded dragons, turtles/tortoises, snakes and leopard geckos. For amphibians, frogs, toads, salamanders, and axolotls. Birds, there's a whole range of birds you may see, but parrots, doves, and pigeons, songbirds, poultry, waterfowl. And then if you do see fish, which there are a few private practices that do see fish here, betta fish and goldfish, and then koi as well are probably going to be your three most common. So your clinical approach to dermatologic disease in our exotic animals is going to be similar to how you would with small animals. So you want to have a systemic diagnostic approach. Dermatologic disease is often multifactorial. So there's multiple different components. And you want to do a thorough evaluation of husbandry. These are almost all secondary to some underlying husbandry concerns. So it's really important to know what is normal for husbandry and then what could be wrong or how they're mistakes that they may be making. And then researching the species prior, if possible, is going to be super beneficial, because that's going to help you to recognize differences in structure and function of the skin in various species, and then recognize anatomical differences. So you know what is normal and what is abnormal in these animals. And then appropriate handling is also going to be an extreme component, and making sure that we are minimizing stress as much as possible. Too much stress can compromise these guys fairly quickly, especially in our birds. So it's important to try and minimize as reasonable as we can. Your common diagnostic tests, these are going to be pretty similar to what you would see with small animals. You can do skin cytology, impression smears and tape prep, skin scrapings, skin biopsy and culture, fine needle aspirations, PCR testing, trichograms, fungal cultures, and then culture and sensitivity for any bacterial infections. These are all similar. The main difference is how you would go about obtaining a sample for our exotic animals. So we're going to kind of start with the most extreme different species from our dogs and cats and do just kind of a brief overview for fish. I think it's important to at least be aware of. But the primary function for the skin in fish is going to be a physical barrier, and then it also helps maintain ionic and fluid balance, which is really important because if there's any issue in the water, this can cause them to become immunocompromised. Their structure is, the main differences is their scales, and this is highly variable between different species. And the photo on the right, you can see this is the skin of a bony fish, which is going to be like tarpon or most of your common fish. The main difference would be like sharks and rays are going to be cartilaginous fish, and they're going to have a different skin structure. But you can see that they have a dermal scale here, and then their epidermis is fairly thin. So some important diagnostic considerations. Like I mentioned earlier, water quality is by far the most important diagnostic test you can do. And oftentimes there's water quality kits you can use. A lot of owners just have the little dipsticks, but there are more advanced ones you can purchase. But as I mentioned earlier, poor water quality can lead to immunosuppression. And then the two most important diagnostics you can do is going to be skin scrapings. And to do that, you're going to take a cover slip and you're going to drag it across the lesion to collect mucus. You want to make sure you're not putting too much pressure because you can damage the scales. And you want to sample multiple sites. This is a photo of doing it in a really small fish, but you can obviously do this in bigger fish as well. And then gill biopsies. And this is because many of our ectoparasites affect the gill in addition to the skin and can lead to respiratory compromise. This typically requires sedation, and in fact, I'd recommend all fish be sedated if you're going to do this, because it does involve using small scissors to take a little clipping of the gill. So the one fish disease I'm going to highlight is ick, which is also known as white spot disease. This is a freshwater protozoan ectoparasite. There is a saltwater equivalent, but we're going to focus on the freshwater one. The clinical signs are white nodules on the skin and fins, as you can see in the photo here, all these little white dots. It can lead to increased mucus production because that's how fish like to heal any injuries to their skin. And then they can also show flashing behavior, which is where they kind of rub their body on different surfaces. And then respiratory symptoms. Ick is one of those ectoparasites that goes to the gill in addition to the fins, so you can actually monitor the respiratory rate or a perculum rate. And if it seems increased, that may be suggestive that there's an underlying problem. To diagnose ick, you can do skin scrapes or a gill clip. The top photo here, this is a gill clip here, and these are the gills. And then these big round structures are going to be ick. And on a skin scrape, it might look like this big circle. They have the classic like crescent shape in the middle, and they kind of just roll around on the slides if you find them. And there's a variety of treatments. Copper sulfate, formalin, increases in salinity. These are all going to be immersion baths. And then occasionally you may have to depopulate because it can be very hard to treat. This is more of a case for the saltwater form, but sometimes we do have to do it in our freshwater species because we just can't get it under control. The important thing to consider with the immersion baths is these treatments can damage other animals in the tanks. So it can kill plants, it can kill like shrimp or any other species. So it's important just to be aware of what other animals are all in the tanks if you're going to treat it. Next, we're going to move to our amphibians. For amphibians, the skin is clinically the most important organ for these guys. The function is primarily gas respiration, osmoregulation, and then water absorption. And this is the photo of the skin of a frog, and you can see they have large mucus glands that keeps them hydrated and protects their skin. Their epidermis is also fairly thin. Some important factors to consider is that dermatologic disease, like I said, is often secondary to husbandry in all of our exotic species. And in amphibians, the skin can actually become edematous or swollen in disease states. Frogs in particular are prone to like liver disease and renal disease and getting ascites. And then for handling, you want to do non-powdered gloves moistened with non-chlorinated water. This helps prevent damage to their skin, and it also helps prevent absorption of any exogenous chemicals such as lotions, hand sanitizers, topical medications. They're going to be able to absorb these through their skin, which can lead to problems because it could be toxic to them. And then ideally changing gloves between individuals so that way you aren't spreading any diseases. And then if you're working with Thessalians, which most people don't see them, but they're kind of like worm-like amphibians, but you want to do minimal handling with these guys because you can disrupt their protective mucus layer. And so ideally you can put them in like a clear container or actually examine them in a plastic bag to try and minimize some of that stress and damage. These are just some of the common cutaneous diseases you may see in amphibians. I'm just going to highlight 2 of them, and that's going to be red leg syndrome and then chytrid, which is a fungal infection. Ranavirus is a good one to be aware of because it has significant implications in the wild populations of our amphibians and has led to significant mortality rates. So red leg syndrome, also known as bacterial dermatosepticemia. This is caused by acute bacterial septicemia, so essentially infection in the bloodstream. And this is caused by gram-negative bacilli, most often like Pseudomonas or Aeromonas hydrophilia, and is often associated with poor husbandry. The clinical signs are pink or red skin lesions, often on the hind limb or the ventrum, so the belly area, lethargy, anorexia, and then if it does spread to the brain, they can have twitching and convulsions. And this is kind of the classic look, is basically red legs. Diagnostics for this, it is important to check water quality as ammonia levels and pH levels can also cause topical irritation that looks really similar to red leg syndrome. So we want to rule out any other sources of irritation. You can do cytology, you can do wet mounts and skin scrapes, and oftentimes you do this similar to how you would in a fish with a cover slip. And then you can also do aerobic and anaerobic culture and sensitivity, and this can be done on blood or coelomic fluid. Treatment prognosis is fairly guarded. You can imagine this is a bacterial infection in the bloodstream, but we can treat them with antibiotics. And then you also want to prevent the spread of infection to cage mates by isolating these animals from any others in the habitat. Next, we're going to talk about chytridomycosis. I'm not even going to attempt to say the actual specific names, but we'll refer to them as BD and B-sal. BD is the frog version, and B-sal would be the salamander fungal infection. These are associated with global anurian or frog population declines worldwide, and they are an OIE, internationally reportable disease, so it's just something to be aware of. Transmission is through water or mud, and then any new animals that may be introduced into the habitat, especially people may find an amphibian in the wild and bring them into their habitat. And this fungal infection infects the keratin layer of the skin, and then it multiplies rapidly. And in this photo, it's kind of these little circle guys here is the fungus. Clinical signs for this are going to be weakness, lethargy, loss of the riding reflex. They often call this frog on the back, and so they can't get themselves back over. Increased shedding. Frogs in particular should shed all in one go. So if you see kind of flaky skin like in the photo, that's going to be something that you may see with this fungal infection. Erythema on the ventrum and feet, and then sudden death as well. Diagnosis is going to be through cytology, histopathology, PCR, and then treatment we actually only really do in captive populations because it can be very hard to treat in the wild. But if you are going to treat it, it's done with antifungals. Next, we're going to talk about our reptile friends. And so their skin function is to provide physical protection against dehydration, abrasion, and then UV radiation. And their skin helps aid in the control of water, gas, and heat exchange. If you remember, reptiles are ectothermic, so they can't regulate their body temperature. So their skin plays a significant role in heat exchange. And then it also can be important for social interaction or the ability to change color, specifically in like our chameleons. Important anatomy to be aware of is their skin is modified into scales, or in our turtles, it's modified into more of the shell. And then they have minimal skin glands. There are a few exceptions, like snakes have scent glands, and then there's like musk turtles. So there are some out there that have more glands than other species. And then shedding is a normal process. So this does occur and it kind of varies between different species, but it's important to recognize it should happen. And then it's important to recognize when it's abnormal. And this is going to be the skin of a lizard. So you can see that the dark black spots here are going to be their scales. They have a pretty thick epidermis to help with that protection. So important considerations for reptiles: pruritus or itching. it can be normal when shedding is imminent. So you may see these guys rubbing on their environment when they're about ready to shed, and that can be normal to see. Systemic disease can have cutaneous manifestation, such as petechiation is often associated with septicemia, so blood infection. And this photo on the right here is a picture of petechiation in a snake, and this would be on the belly of a snake. And then ivermectin is a common antiparasitic used. You cannot use this in chelonians, so that's going to be your turtles, tortoises, and terrapins. It can be fatal and cause neurologic signs, so that's an important thing to be aware of. For diagnostics, you can do skin scrapings. Typically, you're going to use a smaller blade, typically around a 15 to minimize any damage. You can also evaluate shed skin underneath a microscope. So if a client brings in the shed from their snake, you can actually look at that and look for any concerning changes. And then if you're going to do any biopsies, punch biopsies should be avoided in reptiles with large scales, such as snakes, because this can cause significant damage to their scales, and it can impact the histopath results as well. And then radiographs are also really important to evaluate for bony changes, specifically in our turtles, because they can get shell infections. Those can actually go down to the bone underneath the shell, and then you can get osteomyelitis. So looking at an X-ray of these guys can help us determine if that's a concern or not. These are just some of the common reptile cutaneous diseases. I'm going to totally pronounce this wrong, but it's aphthinonesis or the snake mite, and we're going to highlight that one. They do get bacterial, fungal, viral, and they can get neoplasia as well. But the bulk majority that you're going to see with our reptiles are going to be husbandry or multifactorial related diseases, such as dectosis, which is inappropriate shedding, secondary nutritional hyperparathyroidism, metabolic bone disease, and then hypovitaminosis A are going to be the three that we're going to highlight today. So ecdysis, or shedding of the skin, this is a normal process. This occurs continuously throughout their lifetime. If it's like snake species, they tend to do this 3 to 4 times a year. If it's turtles and lizards, they kind of do it throughout the whole year, except for hibernation times. There are 2 patterns. They can be complete, which is what you'll see in snakes, where they shed their whole skin in one go. And then some lizards do this as well. Or partial, which is going to be most lizards, chelonians, and then your crocodilians, if you do happen to see any crocodiles, caiman, or alligators. Dectosis is going to be difficulty shedding, and this is a multifactorial disease process. Husbandry deficits are going to be the most common cause, including ambient temperature and inappropriate humidity, so it is important to know what is appropriate for the specific species. And then diseases can predispose inappropriate shedding, such as ectoparasites, malnutrition, and dermatitis, but there's a whole variety of diseases that can cause this presentation. So treatment for inappropriate shedding is going to be to address any underlying husbandry concerns to prevent this from reoccurring, and then address any underlying medical conditions that might be predisposing them. And then you can do shallow, lukewarm water soaks for 30 to 60 minutes. And then you can follow that with manual removal of the remaining dead skin with like a cotton tip applicator. A lot of reptile owners do this on their own at home, but they may bring them in for assistance. The biggest thing to be aware of is making sure the water isn't too hot to cause any damage, and that they can hold their head above the water so they don't accidentally drown. And these are just some of the complications that can occur with inappropriate shedding. A big one is going to be retained spectacles in snakes. So snakes have spectacles, which are fused eyelids that help protect their eyes. And these should come off in the shedding process, but oftentimes they can get retained and stuck. And you can see in this photo, this is kind of that haziness where it didn't come off. And then here is a classic example of what we call like an eye cap. So you can actually see the circle where it had been over the eye. If it happens over multiple shedding cycles, they can actually get a really prominent eye cap. It's actually pretty cool to see, but this is something that a veterinarian should do because they can damage the cornea if you do this improperly, trying to remove that retained spectacle. And then constriction injuries, which is going to happen primarily with the tails and the digits. So like with our bearded dragons and with the tails of snakes. And this is the shed skin actually constricts down, the skin that didn't shed will constrict down and cause necrosis of that area, and then eventually it will die off and fall. And this is going to be the snake mite. This is the most common mite of reptile species. There is a lizard equivalent as well. It is zoonotic. It can spread to people. And it, like I said, it affects a variety of snakes and lizards. Clinical signs are going to be pruritus, dermatitis, inappropriate shedding, and then anemia. These guys are blood-sucking mites. And these are just a variety of photos of where you might see them on a snake. Diagnosis is going to be identification of the mite on the animal or in the environment. And the treatment is a minimum of 40 days because we have to treat the full life cycle of the mite. And then you can use insecticides like frontline topically, ivermectin, orally, subcu, or intramuscular. And I just wanted to highlight again, you can't use this in our chelonians. Next, we're going to talk about hypovitaminosis A. This is caused by inappropriate diet. This can either be they're being fed the wrong diet, they're not being supplemented appropriately, or they're having issues chewing or digesting their food. Clinical signs are going to be bilateral swollen eyelids, oral abscessation, so ear abscesses, cutaneous changes such as hyperkeratosis, which is an increase in skin production, the dectosis or inappropriate shedding, and then scoot loss in our turtles, lethargy and anorexia, and then they can get secondary respiratory infections. Diagnosis is primarily through a history of inappropriate diet and clinical signs. And the treatment is oral supplementation of vitamin A and then addressing any underlying nutrition and secondary infections. There is an injectable vitamin A. It has a higher risk of an overdose. So actually too much vitamin A can cause necrotic dermatitis. So it's important to make sure this is the underlying disease process before you try to treat it. And this is just a photo of a turtle. You can see the eyelids are swollen and then the ear area is also swollen and probably abscessed. And then last but not least, is probably one of the most common presentations that come in through the ER, but also to private practices. And this is metabolic bone disease or secondary nutritional hyperparathyroidism. And I should mention that all of these nutritional deficits can occur in all of the exotic species we're talking about. They're just more common in our reptiles and amphibians. But this is caused by inadequate absorption of calcium into the bones, which can be caused from either a lack of calcium in the diet, lack of supplementation, or a lack of UVB lighting, because that's necessary to convert the calcium into a usable substance in our reptile friends. And it's caused secondary to inappropriate husbandry, whether that be the lighting or the diet. And the clinical signs often include dermatologic changes, but the classic is an emaciated reptile that's not moving, not eating, like I said, extremely thin and just overall not doing well. And the prognosis is guarded. These are chronically sick animals, and if we don't catch it early, it's very hard to treat. This photo here, this is going to be a normal x-ray of a bearded dragon. You can see the bone density is very bright. And this is going to be a metabolic bone disease, bearded dragon. So we're really skinny. There's multiple fractures if you actually zoom in of the bones, and the spine is curved, just overall doesn't look normal. And the biggest thing with long-term care is that they're going to be prone to pathologic fractures essentially their whole life if this has been a chronic ongoing problem. And this is why husbandry and addressing these concerns when they first bring in their patient is really good to address on the first visit to make sure we can avoid these things from happening. Now I'm going to pass it off to Emma.
Okay, so we are next going to talk about avian. So kind of first start out with structure. So thickness, feathered areas are going to be about 3 to 4 layers thick. The feet are going to be many layers thick. And then we have the epidermis and the dermis. The epidermis is going to have less layers. The dermis is going to be made up of a superficial and a deep portion. And then there's also elastin fibers, which can form tendons. And that is kind of what attaches the muscles and the feathers together. And then kind of in here, we have the epidermis and then the dermis here below. And then here's just kind of a bigger picture. Again, here is the epidermis and then the dermis. And then Keratin, so we have the feet and the spurs, the keratin will wear down eventually. And then the skin, the comb, the wattles, that will slough off. And then feathers, they molt. They have no sweat glands, which is why they are more prone to hyperthermia. And then parasitic, common avian cutaneous diseases that we're going to go over is parasitic, so like scaly leg, and then also bacterial would be bumblefoot, and then some idiopathic or multifactorial diseases we'll go over is feather picking, and then feather follicle cyst. So scaly leg. So scaly leg is common in budgies. The cause is pneumococci. It is burrows into the skin and into the feather follicles. Signs would be scales, crust, kind of this honeycomb appearance, and distribution are going to be on their legs, on their beak. Diagnosis is going to be visualizing the mites based off of a skin scrape. And then treatment is going to be either a topical ivermectin that you can give 3 applications, or you could do 1 sub-Q dose. And then here is kind of an example here of the scales and the crust and kind of the honeycomb appearance. And then this is of the actual mite. And then next we'll talk about is ulcerative pododermatitis. This is going to be an older, overweight avian. Species is going to be budgies, canaries, cockatiels, parrots, such as macaws and amazons, chickens, and waterfowl. The inciting factors include hypovitaminosis A, a poor perch, so that would be if the perch is made of sandpaper, if they're all equal diameter, and then bacteria such as like staph or E. coli. And then different signs that we could see with this is corns and pressure sores. And then just kind of for reference, this is of a chicken. And then diagnosis, a lot of times, is going to be through history, clinical signs, cytology to look for bacteria. And then kind of here down below is the different grades that we have, grade 1 to 5. And then treatment is going to be improving their diet, having different diameter perches available to them in their cages. And then you can do a betadine or chlorhexidine soak in warm water. And then you can also do antibiotics such as amoxicillin if they do have bacteria present. So feather cysts. So feather cysts are hereditary. They are common in caged birds such as like budgies, canaries. Essentially the cause is the feather is unable to erupt. Diagnosis is mainly going to be through history, clinical signs, and then the treatment is going to be surgical removal, and then avoid breeding because it is hereditary. And then this is just the feather cyst there. So feather picking causes, they're either non-behavioral or behavioral. There are many different causes such as parasitic, endocrine such as hypothyroidism, allergies, chlamydia, which is zoonotic and reportable. Infectious is going to be viral, bacterial, fungal, and then malnutrition. Environmental, such as tobacco, smoke, perfume, aerosols, and then lead and zinc poisoning, and then neoplasia. Behavioral is going to be separation anxiety, boredom, attention seeking, hormonal stimulation, which that essentially means is it's kind of mimicking them using feathers to line their nest by picking at themselves. And then change in environment. And the most common cause for feather picking is behavioral. And then diagnosis is going to be through history, clinical signs, cytology, skin scrape, looking for mites, fungal culture, blood work, looking for like hypothyroidism, ultrasound, radiographs, kind of looking for any neoplasia. Rule outs would be ruling out the environmental causes, toxins, or any malnutrition. And then treatment, of course, is going to be finding the underlying cause. You can also do behavioral modification medications such as clopidogrel or haloperidol. And then another thing you can kind of do is there's like an apron that you can make that's kind of like enrichment that they could pick at the apron instead of picking out themselves. And then here's just kind of the different stages that we have. And then small mammals. So here we have our epidermis, our dermis, and then our hypodermis would be below here. So we have the epidermis, which is going to be the most superficial part, which is we have the different types of cells is we have keratinocytes, that is making keratin, melanocytes, which is for pigment, radiation protection, Langerhans, which is processing antigens, and then Merkels, which are essentially influence skin blood flow and sweat production. And then the dermis is going to be made up of connective tissue, collagen is very vascular, and then we also have our sebaceous glands also. And then the hypodermis is very deep. It is made up of loose connective tissue and fat. And then kind of here on the side this is just all the epidermis, and it's showing the different parts of the epidermis. So cutaneous diseases in rabbits. So these are some of the common ones. And you might kind of see repeating all for kind of the small animals because a lot of them get very similar diseases. So we'll talk about ear mites, Chilatella, and dermatophytosis, and then ulcerative pododermatitis. Go ahead. So which of the following common topical flea and tick preventatives used in dogs and cats is contraindicated for rabbits? You all, 50% of you answered frontline and fipronil, and that is the correct answer. And I'll kind of go over that next here. Okay, so Chilatella is also known as walking dandruff. It is a common non-burrowing mite in rabbits, and it is also seen in guinea pigs. Transmission is going to be through contact, fomites, and then clinical signs. They can either be asymptomatic or they can be pruritic or itchy. Crusting, scaling, and then typically it's kind of over the dorsum, which is over the dorsum here. And then diagnosis is going to be through a skin scrape. And you can also do an acetate tape test. You can also do a flea comb, and you can actually brush on a dark surface and they're going to be white, so you can actually physically see them. And then treatment would be either ivermectin, selamectin, or fluorolaner. And then, of course, cleaning the environment, which would include cleaning any fabric they are in contact with, wash it in hot water and then in a hot dryer, and then clean their cages with a safe disinfectant. And then, again, do not use fipronil in rabbits because it is extremely toxic and can cause neurological signs and even death. So Seroptes, also known as the ear mite, is non-burrowing. Transmission is going to be through a direct contact. Clinical signs are going to be head scratching, head shaking, scratching, exudative debris, and then crusting erythema of the pinna, and then otitis media, and even meningitis in severe forms. And then diagnosis is going to be through video otoscope, or you could do mineral oil on a slide from getting a sample. And then treatment is going to be ivermectin or moxidectin. And then dermatophytosis and T metagrophytes. This is going to be the most common dermatophyte in rabbits. Transmission is going to be through contact, fomites. Clinical signs are going to be alopecia, crusting, and then distribution is going to be periocular, nose, and extremities. And then diagnosis is going to be a DTM culture, a trichogram, and then you cannot diagnose this with a Woods lamp. The only one that you can diagnose with a Woods lamp is M. canis. And then treatment is going to be a topical anaconazole, 0.2%, or griselfulvin, which is considered extra label. And then this is zoonotic, but it's going to be more individuals who have atopy or immunosuppressed already that are more prone to getting it. Causes. So causes for ulcerative pododermatitis are going to be lack of activity, poor husbandry, such as like wet bedding, inadequate flooring, obesity, hereditary, which would be like Rexes. Rexes lack guard hairs. And then signs would include fur loss on the bottom of their feet and their hocks, and ulcers. Secondary infections can often occur also, which would be like Staph aureus. And then this can even lead to osteomyelitis in severe forms. And then most times they have a low-grade ulcerative pododermatitis, like almost every rabbit does. It just depends upon how severe it is. Diagnosis would be through history, clinical signs. You do a cytology for any secondary infections. Culture and sensitivity should be done if you see rods on a cytology. And then treatment would be treating the underlying cause, debridement or cleaning the lesions. You could also bandage their feet so they have more padding. You can also do environmental padding, such as like yoga mats, extra layers of rugs. And then secondary infections you want to treat with either topical or systemic antibiotic. And then these are some common diseases in guinea pigs. And we're going to go over cystic ovarian disease and trichofolliculomas. So cystic ovarian disease incidence occurs in about 76% between the ages of 1.5 to 5 years old. And then prevalence is going to be increases with their age, but reproductive status doesn't affect prevalence. So essentially what that means is whether or not they've had babies before, that doesn't necessarily affect their prevalence. And then cause is going to be unknown. Clinical signs is either asymptomatic, and then they have a non-peritic alopecia. That's a very important part. And then distended abdomen and infertility. So diagnosis is going to be through history. You can actually do abdominal palpation and feel them typically, and then ultrasound. And then treatment would be a hysterectomy. Trichofolliculomas. So trichofolliculomas are the most common neoplasia in guinea pigs. They are benign. They don't really know what the cause of them is. They are more of a nodular lesion. They can be dome-shaped, kind of seen in this picture. Sometimes they can have debris that comes from them. Distribution, they're typically on the dorsum. And then diagnosis and treatment is going to be surgically removing them and sending them in for histopathology. So these are our references. And then are there any questions?
I guess anything on they talk about using Brevecto orally to treat stigma.
Oh, I have not heard of that, but that would be kind of interesting. If that is an option, I will have to go look into that more. But yeah.
Okay.
And
Great.
Nope. Okay. Great, thank you so much.
Thank you.
All right, I'll take the mic.
Thank you.
All right, it's lunchtime. So we're gonna go ahead and we will take a break until 1 o'clock. Lunch is served. Everybody at home will rejoin you at 1. Thank you so much for joining us today.